Hi everyone. Today we are going to talk about geriatric falls in the hospital setting. We will be discussing a fall risk assessment, outcomes from falls, fall prevention, safe discharge, and follow-up home safety. Let's begin by discussing fall risk assessments. A number of things can cause a patient to fall, including how awake, alert, and oriented a patient is, and what the current diagnosis is. Altered mental status causes falls because the patient is unaware of what they are doing. Is the patient able to move around on their own, or do they need assistance with activities, for example, incontinence issues? According to the Journal of General Internal Medicine, half of falls were elimination related, which was more common in patients over 65 years old. Elimination-related falls increase the risk of fall-related injury. What types of medications are they currently taking, such as benzodiazepines, sedatives, or antipsychotics, and if they have had any of those on the day of admission? These types of medications can cause a change in mental status. Also, record a thorough medical and surgical history. Generally, falls occur according to age, health conditions, and medications. However, most falls can be prevented. Predictors of future falls are gait balance disturbances, visual impairments, medication variables, decreased activity of daily living, and impaired cognition. According to the article, Will My Patient Fall?, patients who have fallen within the last year or have gait or balance disturbances are at a higher risk for falls. Early recognition of geriatric patients at risk for falls is key to decreasing falls. Here you see we have a fall risk assessment tool. The tool is to help to identify those who are at risk of falling. So the more questions that are answered yes makes the individual a greater risk to falling. The fall risk assessment tool also includes review of patient medications, environmental hazards, physical exam, past medical history, vital signs, gait balance evaluation, and mental status evaluation. And finally, the fall assessment should be done at the initial contact with the patient. Here we have the Detroit Medical Risk for Injury algorithm. Unfortunately, falls will occur during a hospital stay for some patients, and those patients' outcomes will change. We have to ask ourselves a few questions as regard to outcome. Who are affected by hospital falls? Obviously, patients are, but also the family, the hospital, and the hospital staff. What kind of injuries can occur from geriatric falls while in the hospital setting? Many injuries can be experienced, including fractures, soft tissue injury, head injury, and change in mental status. After hip fractures, 50% of people never return to prior level of function, and 30% die within 6 months, according to Fitzpatrick. How do falls affect the length of stay for geriatric patients in hospital settings? Length of stay average is 12.3 days longer for patients. What additional cost is involved in geriatric falls? About 61% increase in the cost to care for this patient. New Medicare reimbursement rules. Medicare will not provide additional reimbursement for certain categories that occur during hospitalizations. Fall and trauma are included in these categories. So who is responsible for additional costs for the hospitalization? Unfortunately, the hospital would be responsible for any additional cost. Litigation is always a possibility for any adverse outcome that occurs in the hospital setting. Also, long-term effects for falls for these patients include, after any hospitalization, geriatric patients may require post-acute placement either in a skilled facility, acute rehabilitation facility, or even possibly long-term placement facility. So since we have now discussed fall risk assessments and what the outcomes are from falls, let's discuss how to prevent falls. Fall prevention is by determining appropriate interventions for fall prevention begins with assessing the fall risk assessment. By identifying those at risk, registered nurses can target fall prevention strategies. Falls can be prevented by using visual cues such as fall precaution signs placed in front of the patient door, colored wristbands, and bed alarms set to on. The yellow fall signs alert certified nursing assistants and nurses that the patient is at risk for a fall. Additional fall prevention strategies include keeping rooms clutter-free and a clear path to the bathroom with assistive devices nearby, the use of high-low beds and floor mats, call bell within reach, wearing slippers or socks before getting out of bed, and assessing room placement and placing high-risk patients in front of the nurse's station for closer observation. Also, when nurses take their breaks, have another RN watch your patients while you're off the floor. Here you see are what we call our falling stars. These are visual indicators to nurses, nursing assistants, and hospital staff that these patients in this room are considered our high-risk fall patients and need close monitoring. This is a picture of a clutter-free room, what the room should appear to be. Should have wires up, floor clean and dry, nothing in the way of traffic, no trip hazards, and an obvious clear path to the bathroom. On the left is a fall risk bracelet. These bracelets are applied to our fall risk patients as another indicator of their status of being fall risks. On the right, we have an elderly woman in a wheelchair with a personal alarm. The alarm is attached as a means for if she stands up, the alarm will go off and alert staff that she's in need of assistance and to go to her right away. Here we have the POSI alarm. On the left is the mat that goes underneath the patient. On the right is the POSI alarm itself. The POSI alarm is great because you can have families actually record certain phrases saying something for their family member to recognize, such as, "Dad, please sit down till the nurses can get to you so you don't fall." Things like that. That way, family can recognize voices and be more willing to sit down to a familiar voice than to a non-familiar voice, such as nurses or the mechanical voice of the POSI alarm itself. Here's the example of a high-low bed on the left and floor mats on the right. Learning from and being helped by other healthcare providers, especially physical and occupational therapists, is great in helping with the reduce of falls within the hospital setting. Both patients and families should be involved as part of the team fall prevention effort. Patients should be asked to call for help when they want to get up. Now we will be discussing safe discharge and home safety. The Center for Disease Control and Prevention report that falls are the leading cause of injury-related deaths in individuals 65 years and older. Falls at home are often due to hazards that are easy to overlook but easy to fix. Preventing falls at home is a continuation of care for those who have been considered a fall risk within the hospital setting. A variety of fall prevention programs targeting community-dwelling elderly adults have been established and critically evaluated. Fall prevention in the home is as easy as 1, 2, 3 steps. 1. Have a fall risk assessment and review of your medication performed by your physician or a trained healthcare professional. 2. Engage in regular physical activity. And 3. Get an assessment of your home environment and make changes to reduce safety risks. According to the Lawton and Namaus theory of environment press, well-designed environments and effective home modifications should function to reestablish equilibrium between a person's capabilities, which may have declined, and the demands of the environment. Reducing falls in the home setting is simple as modifications such as replacing loose or broken items, removing rugs in high-traffic areas, picking up clutter such as books, papers, shoes, etc., tying electrical cords up so they are not laying on the floor, causing a trip hazard, add extra lighting to dark rooms, replace frequently used items in the kitchen at arm's reach, make sure step stools are safe and secure, place non-slip rubber mats in tubs, and add handrails to the bathroom for support. Also, have a professional assess the home for safety risks and additional needed modifications. Engage in physical activity. What's a proper physical activity? What's a physical activity is of interest. When considering physical activity, StopFalls.org suggests to consider targeted balance and mobility exercises that are most effective at reducing falls. Also, get current on physicals, eye exams, etc. Also, have a pharmacist or a physician assess your medications for any possible interactions. An evidence-based practice on falls. A study done January 2009 through June 2009 compared fall rates in 4 urban U.S. hospitals and units that received usual care or the intervention. Slightly more than half of patients were 65 or older with the average age of 79 years old. Among the younger patients than 65, average age was 48 years. A doctor and colleagues investigated whether a fall prevention toolkit using health information technology would decrease falls in hospitals. Nurses would complete a valid fall risk assessment scale. The fall prevention toolkit software was tailored fall prevention to patients determined of fall risk. The fall prevention toolkit produced bed posters composed of brief text with accompanying icons, patient education handouts, and plan of care. All communication patient-specific alerts to those involved with patients. After intervention periods, the researchers found that fewer patients had falls in intervention units than in control units, analysis indicated. The intervention units had significantly lower adjusted fall rates than the controlled units. The researchers also found the intervention was significantly better for older patients, but no effect in younger patients. This concludes the presentation on geriatric falls within the hospital setting. Thank you, and I hope you enjoyed the presentation.